everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. Today we're going to be talking about incarceration versus rehabilitation in our series on the drug war. So we're going to start off with a fun fact here. About 1.3 million of the 2.3 million incarcerated people in this country, America, the United States, are in state prisons for drug-related crimes. The most common crimes that result in incarceration are drug-related. The United States has the world's highest prison population, both per capita and in total numbers. This really makes you rethink the phrase land of the free. So Pew says that drug arrests stayed high even as imprisonment fell from 2009 to 2019. So we'll just go over some more numbers here. We love numbers on this channel. So drug possession arrests held steady at more than 1 million a year, in stark contrast with a large reduction in overall arrests, which dropped 29%. Only 1 in 13 people who were arrested and had a drug dependency received treatment while in jail or prison. Racial disparities in drug enforcement declined. Arrest of Black people for drug offenses fell by 37%, more than 3 times the drop among white people. And increased arrests of white individuals per possession of methamphetamine offset declines in marijuana arrests and drove the reduction in racial disparities. So, I would say that would be mostly poor white people. Just pointing that out. I would assume. So the numbers of people admitted to and held in state prisons for drug offenses both fell by about 1/3, accounting for 61% of the overall reduction in prison populations and 38% of the total decline in admissions. The decline in the number of Black people incarcerated for drug offenses made up 26% of the decrease in prison admissions and 48% of the drop in prison population. Drug and alcohol-related mortality rates increased 5-fold in prisons and 3-fold in jail, despite the decreases in the number of people in prison for drug offenses. So, okay. If I'm interpreting this correctly, I would only assume that this would be either due to withdrawals or contraband in the prisons. Like, whether someone's dying from withdrawals from, benzodiazepines or alcohol, or whether people are overdosing, which is also happening because contraband is snuck into jails and prisons pretty easily, actually. Happens a lot, in my experience at least. So that, they really don't monitor that well. So we're going to go to a chart here. This is possession arrests stagnated while drug sale arrests, numbers of people sent to and held in prison all fell by about 1/3 over a decade between 2009 and 2019. So let's see. Possession went down 0.4%, and sales and manufacturing went down 32% in arrests. And then prisons went down 34% in admissions and 33% in population. Next chart here. More people were arrested for drug possession than any other type of crime in 2019. So we can see here the drug offenses. Possession is about 1.35 million people, and sales or manufacturing is about 210,000 people. So that's about 1.56 million people altogether. Property crimes come next at about 1.07 million. Then simple assault, 1.03, DUI, 1.02, and violent crime, about 500,000. So the next chart here is arrests remained constant for drug possession but declined for other crimes. Percent changes in arrest and share of overall decrease by offense category from 2009 and 2019. So, all right. The total arrests went down 26%. Let's see here. And then property crime reduced by 38%. And the share of the total arrest decline was 18%. Drug sale or manufacturing percent reduced is 32%. And the share of total arrest decline was 3%. And then DUIs went down 29%, and the share of total arrest decline is 12%. Simple assaults went down 22%. Share of total arrest decline is 8%. So violent crime went down 15%, and the share of total arrest decline was 2%. And then drug possession, we see here, real tiny. It only went down 0.4%, not even a full percent. Not even 0.5%. And the share of the total arrest decline is only 0.2%. And not even 0.25% there of the total arrest decline. So as we can see, there are arrests overall are pretty greatly declining, but the drug possession arrests are not declining, meaning that proportionally more and more people are in prison simply for drug possession rather than any other type of crime.
Or they are declining, but not by a lot.
Yeah, they are.
They are declining, yeah.
They are declining, but I mean, they're barely declining.
Yes, yeah, but they are.
They are declining, yeah. I will correct myself there. It just, in the grand scheme of things,
not as much as they should.
They're not declining. They're barely declining at all.
Yeah.
So racial disparities in drug arrests fell in this next chart, but remained pronounced. So 2009 arrests. The blue is the black population and the orange is the white population. And remember that African Americans make up about 13% of the American population when we're looking at these numbers here. So we can just keep that in mind. And the 2009 arrests, 26% were black and 74% were white. And then in 2009, 22% were black and 78% were white. And then we look, okay, it was a little off. The population in 2019, black people made up 14% and white people made up 67% of the population. And that's in the youth. Sorry, I should specify that earlier, but that's the youth. Adults, you can see a little bit more of a disparity here. So black people made up 35% of 2009 arrests and white people made up 65%. Then we jumped to 2019, 27% of 2019 arrests and 73% were black and 73% were white. The population of 2019, black people made up about 12% and white people made up about 72%. So yeah, you can definitely see some disparities there. All right, and we're going to look at a graph here next. Rising arrests for methamphetamine offset decline in those for marijuana. So marijuana is in the green, methamphetamine and other dangerous non-narcotic drugs are in blue, and then in the pink we have heroin, cocaine, derivatives, and then in the orange we've got synthetic or manufactured drugs. So marijuana arrests did go down from about 758,000 to 500,000. And then we see an increase in the methamphetamine and other dangerous non-narcotic drugs. I don't know why they say that. It kind of implies that methamphetamine is a non-narcotic, but it is a narcotic. But I think they just worded that a little differently. So with methamphetamine and the other related drugs, it's about 242,000, increased to about 483,000. And then, of course, with the heroin, cocaine derivatives, it seems to be pretty steady here. only going up a little bit from 294,000 to 305,000. And down at the bottom, the synthetic manufactured drugs, 61,000 to 62,000, also remaining pretty steady down there. So yeah, we can definitely see that there's a lot more arrests with methamphetamines and the marijuana arrests are also going down, which I would assume the marijuana arrests going down would definitely be to states legalizing marijuana.
Yeah, I would. That's what I was thinking too.
And then there's the increase in methamphetamine use as well, which, yeah, I think, like, this is going to be a little opinion right here, so don't take this as a fact. But in my experience, methamphetamine users tend to often commit other crimes as well, getting them caught. But also, there's a lot of people just caught for possession. Not saying that because that does happen a lot. But I think, like, methamphetamine is specifically a drug that inclines people to commit more illegal activity, just in my personal experience related to other drugs, even related to, like, heroin or cocaine or crack. I don't know about crack, but definitely with, like, heroin and cocaine, like, comparatively, like, and I mean, obviously, there's a lot of users that do commit other crimes, but it's especially prominent in the methamphetamine users communities. Like, that's just my personal experience, though. So don't take that as a fact. Just take that with a grain of salt. That's all. So then we've got next chart here. We've got a lot of charts today. Number of white individuals arrested for methamphetamine spiked during the 2010s. Arrest and by rate and substance, 2009 and 2019. So we see the marijuana arrests go from 67% white and 32% black and then 1% other. About 570. Yeah, we went over that number. And then 2019, it adjusted to 58% white and 37% black and 4% others. So it looks like the racial disparity for marijuana arrests specifically are increasingly targeting people of color more than white people. Like, that trend seems to be increasing from these charts. But with methamphetamine use, in 2009, white people made up 80%, black people 9%, other 1%. And then we look in 2019, white people are at 81%, went up by just 1% there. And then black people 15%, and then 5% other. In 39 states, the number of people sent to and in prison for drug offenses fell by about a third over 10 years, from 2009 to 2019. So, right. The orange is percentage change in prison population, and the blue is percentage change in prison admissions. So it looks like the total prison population went down by 10%, and percentage in prison admissions went down by 24%. Meanwhile, the percentage change in prison population increased by 3% for violent crimes, but the percent change in admissions went down by 14%. Property crimes, we see the prison population goes down 27%, and change in prison admissions goes down 36%. Drug offenses, prison population change is 33%, and change in admissions is 34%. And finally, we have public order, which population increases by 3%, but the change in prison admissions goes down 8%. All right, and then the number of people in prison fell over 10 years, driven by a decline in incarceration for drug offenses. So the change in prison admissions and population by offense type, 2009 to 2019 again. So, right, the change in prison admissions, here are just the numbers of the populations here. We can just look at them. We just went over the percentages. So the orange is violent crimes, the blue is the drugs, green is property crimes, and then pink is the others. And then the number of Black and Hispanic people entering state prison for drug offenses fell dramatically from 2009 to 2019. So this is by race and sex. So the white population of people entering state prison for drug offenses, for males, it fell by about 1,500. For females, it increased by about 3,400. Then we see the Black people who are entering state prison for drug offenses. Males are at about dropped by about 31,000, and females dropped by about 33,000. And then Hispanic population dropped by about 14,000 for males and about 1,200 for females. And then the male population total dropped by about 47,000 for males and only about 1,000 for females. So it actually, it looks like more and more women are, it does technically decrease, but more white women are getting arrested. And then all the other populations are decreasing. So that's interesting.
Yeah.
And then we have the next chart here. It's the share of prison admissions that were drug-related varied widely across the nation. Drug offenses as a percentage of total admissions by state in 2019. So the U.S. average is about 24%. We see here it goes, this first color is 1 to 10%, and then 11 to 20%, 21 to 30%, 31 to 40%, 41 to 50%. So if you want to pause and look at this, you can look for your state and see how y'all are doing. My state's doing about average. Next chart, we have, in most states, the number of people in prison for drug offenses declined from 2009 to 2019, but 11 had increases. So this is the 10-year percentage change in drug-related prison population by state. So let's see. I'm assuming, I think the blue is an increase. Yeah, I think the blue is increased and then the orange is decreased. So once again, you can pause to look at your state. All right, and then that's all the charts we have from Pew today. And all right, so basically the U.S. drug epidemic is just, it's getting worse. In 2016, about 64,000 Americans died from opioid overdoses. This is more than the death tolls for Americans in the Vietnam, Afghanistan, and Iraq wars combined. Meanwhile, in Portugal, where all drugs are decriminalized, the drug-induced death rate is 5 times lower than the average for the EU and is 1/50th of the United States. It's 1/50th. So that's like 2%. Its rate of HIV infection has dropped from 104.2 new cases per million in 2000 to just 4.2 cases per million in 2015. Drug use has declined overall amongst the 15 to 24-year-old population, the most at risk of initiating drug use.
Okay. And then, so I just have a couple more statistics, I guess, on incarceration too. The first one I have here is just another graph picture that just kind of gives another visual of how many people are incarcerated for, I believe it's, or it might just be offenses, I guess. It's from the Federal Bureau of Prisons, and it's offenses, and mainly you can see here the drug offenses are number of inmates. So 66,677, which make up 45% of the inmates. So I just wanted to show that too. We can have all the visuals today.
Yes.
And then just some more data information here too. Millions have been subjected to criminalization, incarceration, and lifelong criminal records due to this war on drugs. This has disrupted, if not eliminated, access to adequate resources and support to live healthy lives. Drug offenses, as we've talked about, remain the leading cause of arrests in the nation. From the period of the 1980s to the 1990s, incarceration rates for drug-related offenses skyrocketed. Over 1.1 million drug-related arrests were made in 2020, and the majority were for personal possession only. Estimates suggest that roughly 20% of people who are incarcerated are there for drug charge. Black people made up 24% of all drug arrests in 2020, despite the fact that people of all races use and sell drugs at similar rates. Incarceration rates for drug-related offenses have been decreasing, as we saw in recent years. This has been motivated both by cost savings and criminal legal reform efforts to promote a public health approach to drug use. Those with a history of imprisonment also earn 52% less than those with no history of incarceration, leading to disparity with wages once released. So, if people are being locked up for drug offenses, then the drug war must be effective, right? Well, actually, criminalizing people for drug offenses is a huge monetary burden. There's about $10 billion a year spent by states and the federal government to imprison drug offenders. Those estimates do not include the added costs that incarceration has on economic and social aspects. The Drug Policy Alliance in 2015 estimated the U.S. spends $51 billion annually on initiatives and policies aimed at fighting the war on drugs. These include, but are limited to, incarceration, probation, parole, and funding the DEA. In 2021, there are estimates that the U.S. has spent a cumulative of $1 trillion total on said initiatives and policies. So
hold on. Is that all together or is that just in 2021?
No, I think that's all together.
Okay. Because, that's still a lot of money that could be used elsewhere, but okay.
Since probably 1971-ish, give or take, when they started it.
Yes.
That's a lot. Because what is the national debt? Do you know off the top of your head? I know it's
I have no idea. I'm pretty sure it's 8 figures now or something like that, at least.
Let me just Google it super quick.
Oh no, it's
granted, the debt isn't bad, as we kind of discussed with monetary theory, but I know people freak about it. Yeah, even though we don't need to. But that's okay. I still want to know the number.
But it's not about the debt. The problem with the debt is that we're spending the money poorly.
Yes. I'm assuming this is trillion because it goes 100,000 million billion trillion.
What, I'm going to guess 14 trillion?
31.
31. Oh, I was way off. Wow.
Yeah, I don't like this clock though because it says debt per taxpayer, but we don't owe that money. Nobody owes that money. We can talk about it sometime. How MMT sees it, because I find it interesting. But anyways, so $1 trillion total. And I'm assuming, since they started the drug war would be my guess. Yeah. Since it says cumulative.
Oh, yeah, that's true.
I'm assuming just by 2021. So that number's probably gone up since, we haven't stopped the drug war yet.
It's been another 2 years. So that number's definitely gone up.
Because annually, they said we spend $51 billion.
Yeah, and that's a lot of money.
I don't think any of us will ever see that kind of money.
Yeah, probably not me.
Yeah. But so, as we can see, locking them up in prisons is a monetary burden, and while funding services and programs isn't necessarily a bad thing, it is a very wasteful way to spend when the outcomes lead to more crime, more drug use, more arrests, and more incarceration. So here we have some examples. Because there are very few programs, if any at all, available in jails and prisons, and there is a lot of contraband in these facilities, recidivism rates remain very high due to lack of treatment and exposure to more criminal behavior. There is hardly any kind of rehabilitation within our jails and prison systems, if any at all, depending on the jail or prison. This means we are not doing anything to actually help prevent future drug use or future crimes. Researchers estimate 65% of U.S. prison inmates have an active substance use disorder, according to the National Institute on Drug Abuse, and yet few receive any form of recovery services. For drug trafficking offenders, rearrest rates ranged from 29.9% for offenders with 0 criminal history points to 74.9% for offenders with 13 or more criminal history points. And according to the National Association of Drug Court Professionals, 95% of incarcerated addicts use drugs again after they're released, and 60 to 80% will commit a new crime, often related to their drug addiction. Just as troubling, overdose is especially high once inmates are released from prison. This is because users who quit and then use again often overestimate their tolerance. Data from 2012 showed a 1% increase in the prison population. Data from 2012 showed that there's a 1% increase in the prison population, resulting in a 0.2% increase in the violent crime rate and a 0.17% increase in property crime rate. So basically it's showing that as the prison population increased, there was also increases in violent crime rate and increases in property crime rate, although what you would think is that they would go down, but they were going up according to the data from 2012. So that might have changed by now too. And then today, a large body of research backs those early observations, concluding that jail time doesn't discourage criminals from future crime. People who are sent to prison often reoffend. They aren't deterred by their time behind bars. All of those lead to, if not increasing, the costs.
In addition, doing drugs on its own isn't something that isn't, well, I mean, it could be physically harmful, but it's not inherently harmful, at least no more harmful than drinking alcohol is. Like, any argument you can make about sending people to prisons for drug use could also be made against alcohol use. And we already talked about how the prohibition ended up.
And if the drug were effective, another thing we'd want to see is a decrease in deaths from overdose, because we would hope that, obviously, if the drug were effective, it was helping people and preventing overdoses. So let's look at some information here. More than 932,000 people have died since 1999 from a drug overdose. In 2020, 91,799 drug overdose deaths occurred in the United States. The age-adjusted rate of overdose deaths increased by 31% from 2019 to 2020. So it was 21.6 per 100,000 in 2019, and then in 2020 it was 28.3 per 100,000. Opioids, mainly synthetic opioids, are currently the main driver of drug overdose deaths. 82.3% of opioid-involved overdose deaths involved synthetic opioids. This is due to the use of fentanyl in enhancing the high of opioids and illicit opioids. Drug overdose deaths involving psychostimulants such as methamphetamine are increasing with and without synthetic opioid involvement. So as we can see, the drug war has been ineffective in helping to prevent overdose deaths. And we will be going over preventing and managing overdoses tomorrow too.
Yes. And we want to see an increase in rehabilitation. So according to Statista.com, from 2003 to 2017, the number of facilities has stayed the same. But if we really wanted to fight this war on drugs, we would create more facilities, because these treatment centers are where addicts will really get help. So over the last few years, 2018 to 2020, it does appear that more rehabilitation facilities are being built, which would hopefully indicate that we're moving away from criminalization and towards rehabilitation. But to me, it still begs the question, why wasn't that even the goal in the first place? And when a police officer interacts with someone using drugs, they are not brought to rehab facilities. Instead, they are incarcerated and not given reliable resources to move towards recovery. Not to mention how pricey rehabs can be. Very few states have programs that provide free or cheap rehabilitation, and oftentimes these places have very faulty programs with low recovery rates. And I mean, the recovery rates are hard to track, so let's talk about that. Even though just about every rehab program promotes an 80% or higher recovery rate. These are based off of surveys that may include extreme cases of bias, where ex-patients are reporting to staff members that they want to look good for. Like, you just don't always want to tell your ex-counselor when you've relapsed. Like, you don't want to be disappointed in you. I mean, and how do you even measure the success rate of a rehabilitation center? If someone uses a drug just once after leaving rehab and then doesn't use it again, is that a success or a failure, for example? So we need to work not only towards building more rehabs, but regulating them more so that they will be as effective as possible for patients, and patients feel they can give honest feedback when surveyed. And regardless of the current state of many rehabs in the country, they are still very preferable to incarceration. I just really want to emphasize that. And as rehabs are focused on challenging addictive thoughts and changing behavior, whereas incarceration is focused on punishment for using. And now that we've discussed rehab versus criminalization, we're going to move on to housing and employment in our next video.
And as always, you can leave a comment below if you have any ideas for future topics that you'd want us to go over.
You can reach out to us on Facebook, YouTube, Instagram, Twitter, and TikTok. We also do some Twitch live streams, so make sure to follow those so you're notified when we go live.
And don't forget to like this video and follow or subscribe and turn on notifications so that you get notified of the rest of our content as well. Otherwise, we will see you all in the next video.